I'm Robin. I'm the Partnerships Lead at Healthwatch Croydon.
I'm Jeanette, I'm the Practice Manager at Dr Baskaran and Partners in New Addington.
It's good to meet you, Jeanette. So Dr Baskaran's surgery consistently gave the right information around registrations. Could you tell us how you achieved that?
I've made sure that all the staff here are fully trained. Everybody within the practice answers the telephone and deals with inquiries. If somebody phones in to register at the practice, we invite them in to meet our senior GP, who does a meet and greet. Once that's completed, they come back to the front office to speak to one of the receptionists, who will give them the forms to fill in, and if possible we register them straight away. On occasions we've then put an appointment so that the new patient can actually see the doctor. We are very open here, all of us answer the telephones, all of us deal with queries as and when they occur. If the telephones are busy at the front, the staff in the back office answer, and it's a consistent message as all staff have been trained to deal with the issues and registrations in the same manner.
That's great. So that kind of brings us on to our next point. So Dr Baskaran's surgery had shorter waiting times than average. So how did you achieve that?
We all answer the telephones. If the girls at the front are busy, we have the doors open, we can hear that, and the staff in the back that manage other processes always answer the telephone. Everybody uses the same terminology, the same message, so that if you phoned today, you would hear the same message that you would get if you phoned again next week.
That's brilliant. So the staff are seen as being helpful and having a good attitude. How did you achieve that?
In part that's because most of the staff are local, so they already live here, so they know the people that live here, they know the kind of people that live here. They all have children, grandchildren. I have a disabled son, so we understand the issues that people have, and we can empathise, and we treat people the same way that we would expect to be treated if we went to register at practice.
Your staff were seen as consistently helpful and having a good attitude. Could you tell us a bit about that?
We have empathy with the patients. We've got children, grandchildren. I've got a disabled son. We understand the people that live here. We live here ourselves, and we try to be a friendly practice. We're trying to encourage people to join us because I think we offer a very good service. We have an almost walk-in service. If you phone and you've got an issue or a problem, the doctors will automatically see you unless it's something that they can't deal with, and then we would suggest that you went to the hospital. As a general rule, we treat patients the way that we'd like to be treated ourselves, and I've indoctrinated this into my staff that we always are nice and we're kind, regardless of how people speak to us. I've instructed them that you're always nice. In fact, most people when they speak to us are speaking to a role and not an individual, and the staff are aware that regardless of what people are saying, they're speaking to a role, not necessarily an individual. And we found that that helps to keep that consistent message. We all speak the same language, we all say the same thing. When somebody comes in or telephones, then everybody would say the same thing. It's a consistent message. The staff in the back pick up the telephones. The telephones rarely ring for long. They rarely go. We don't have a messaging service because we always answer the telephones. Friendliness, openness, and encouragement to join our practice.
Which brings me on to this. Could you tell us a bit about this?
We have quite a lot of young patients, and we give these out when the children come to the baby clinic. But we found that actually when children come, that even something as simple as this and a biscuit is enough to make the experience a happy experience. And so if we could do more of this, we would. If we'd like to have a bit more room and to be able to open that facility up to make the experience a bit more pleasant. But this is a start.
Thank you, that's lovely. Thank you.